I need a glass of water. Okay,
How old that one is.
it looks. I'll go out and get something. I was gonna say, from a water supply point of view, that looks like turbidity.
Questionable. Turbidity.
Were you able to get your size?
Yes.
Okay, did you open?
Yes, and I checked, it's okay.
Okay, and did you try
Oh,
out
no,
this? Okay,
yes,
so you are this one? Oh, yeah.
yes,
Okay, so is presenter mode good?
yes.
Okay, and so forward, back, and if, will you want the laser?
Okay, so right is forward,
Yes,
left is backward,
and green,
and the green.
okay. But you are going second.
Second.
No, it's fine. I already. So, I didn't understand your question. There is a way I understand.
I don't know.
Good afternoon, everybody. Good afternoon. Hello. Welcome to the verbal presentations. This is the session on WASH financing. Though I've just been talking to the three presenters, and it's really just about money, how money flows, how it gets spent, who gets it. So less about the sort of financing, but just more about money, user charges, subsidies. So I think we've got three really interesting presentations. I've conferred with the three presenters, and what we're proposing to do, because the three presentations are all on interlinked subjects, I'm proposing that we'll do one presentation after the other, no questions in between. You have to hold back, make a note of your questions, and then we'll bring all three presenters up to the front, and you can ask questions of any or all of them as you wish. Is that okay with everybody? Yeah. I was just thinking that what would happen if somebody said no. Okay, well, luckily for me, it sounds like that's okay. So we're going to start revenue patterns of piped water services in rural Africa. Andrew Armstrong from Oxford University. Thanks.
I don't know if that clapping was for Clarissa doing such a great job introducing me, or for me starting here. Let me see if this works. Okay. Good afternoon, everyone. Really, thank you for coming to this last verbal session of the conference, waiting till the very end. But my name is Andrew Armstrong, and this afternoon I will be presenting findings from an analysis of revenue patterns of piped water services in rural Ghana, Uganda, and Rwanda. This has been conducted with colleagues at the University of Oxford as part of my PhD research. This work was funded, or is an output of the REACH program, which is funded by the UK Foreign, Commonwealth and Development Office. I'm going to begin by sharing a few brief words about the motivation for this research. Where's my pointer? So you kind of see the tracker down here at the bottom. I will also identify the specific research questions that we've attempted to address, as well as the methods of two specific papers that I'm kind of summarizing today. And then I will finish with results and the implications for policy and practice. So first of all, we are interested in enhancing user payments for water services, particularly in rural Africa, where upgrades are needed for about 500 million people and in half of all rural schools. The investment needs in rural Africa are greater than any other region in the world, and the relative importance of user payments are only going to increase as the cost of maintaining services is greater than the cost of new infrastructure needs. Unfortunately, so covering recurring costs with user payments is a chronic issue. But in Africa, we have data from the most recent GLASS survey that less than 5% of African governments are able to cover their recurring rural water supply costs with user payments. So user payments are a critical need. Second, we also recognize a notional interest in piped water for increasing service levels and increasing revenues. We hear about it all the time, but there is a lack of empirical evidence particularly around the influence of household connections and seasonal water use. We're interested in seasonal water use because those of you who are involved in pipe to water services or hand pump services, in rural areas when households use multiple water sources during the wet period, they use rain-fed water sources, and that can influence the revenue that's generated by that service when demand decreases. This lack of knowledge can lead to really unrealistic assumptions when infrastructure investments are made, particularly around how much water households are going to use and pay for, the revenue collection approaches of service providers, as well as the revenue that's generated overall. So based on this evidence gap, we present findings from an empirical analysis of a multi-country longitudinal data set to answer 3 questions. Question 1 is, how do rates of revenue generated from user payments differ across rural piped water connection types? Second question that we're addressing is, how does seasonal rainfall influence rural piped water revenue? And then the third question is, what implications do these findings have for piped water investments in rural Africa? We've collated data from 6 service providers that operate more than 5,000 piped water points across rural Ghana, Rwanda, and Uganda. 2 of these service providers are international NGOs that operate as social enterprises. The other 4 are private companies registered in country that provide an array of engineering, construction, and consulting services. The data set covers years 2016 to 2019. So we got in just before the pandemic messed up everything. And it covers about 4,888 monthly records of water production and financials, including revenues generated, tariff levels, and payment modalities. And then we overlay on top of that data from a publicly available data set, rainfall called CHIRPS. And from that data set, we've calculated wet and dry seasons based on the average annual mean. And we have identified across this data set 635 dry season to wet season transitions that we're focusing on. Beyond just looking at the binary wet-dry classification, we're also interested in nuances, intra-seasonal nuances that might influence the way people use and pay for water. And so we've calculated a few other metrics, average monthly precipitation, the duration of dry season, and instances of dry days during the main wet season, which is kind of an indicator of rainfall variability. I'll come back to that later. All of these methods, if you want to read more in detail, are available in 2 open source peer-reviewed journal articles with the DOI links here, and those are on all the subsequent slides if you want to take a look at those. Instead of looking at revenue generation at the level of individual service providers or kind of taking a case-based approach, what we've done is apply a method known as archetype analysis and sustainability research, which clusters service areas with distinct characteristics at different levels. So we've clustered all these service areas into 4 different groups. At the multi-country level, we were interested in this because this allows us to look at revenue rates across the entire data set. At the single country level, that allows us to look at specific factors that might influence the enabling environment factors that might influence how revenue is generated across the country. And in our data set, the only country where we had multiple service providers present was Uganda. So this second cluster of data is looking at operators in Uganda. And second, we cluster service areas based on whether the initial investment was led by the state or by a private enterprise to demonstrate the micro scale influence of factors that correlate with planning and implementation. So things like the origin of infrastructure, the design philosophy, the project delivery method, and the sources of upfront project finance. We anticipate that these contrasting investment approaches between an enterprise approach and a public investment approach might influence revenue generation from user payments. And for regression, we use generalized estimating equations to determine whether connection type, which is on and off premises, categorized as on and off premises, exhibits association with revenue And we look at revenue, either average monthly revenue, or we look at also the change between the wet and the dry, the dry and the wet season, dry to the wet season. And we use these GEEs to control for tariff level and clustering by operator. So on to some of the results. This chart right here that you see shows revenue rates by connection type. So on the y-axis is mean volumetric revenue. So this is US dollars in 2019 at PPP per cubic meter. By these four archetypes that I just described. The blue bars are on-premises connections. The red bars are off-premises connections. This chart also shows payment approach in parentheses here, but it's because it's in the paper. You can go read about that, but I'm not talking about that today. So what we can see generally from this chart is that across all these different archetypes, on-premises connections generate higher volumetric revenue than the red columns, which are off-premises connections. However, when we look at the amount of water that is distributed from these off-premises connections, we find that the off-site, these are kiosks and standpipes, provide an aggregate revenue benefit in 3 of these 4 archetypes. So what that means is these water points facilitate more water usage from people. Also, when we run the regression, we find that when tariff levels are controlled, the on-premises connections are not associated with significantly different revenue than the off-premises connections. And that's consistent across all the archetypes, across the entire range of observed tariff levels. And these patterns are recurrent at multi and single country scales, and also between enterprise and private-led or public-led investments. On the rainwater side, I'm going to keep moving through this. We can come back with questions. But on the seasonal variability side, results show that operators experience revenue variability at regional and intra-seasonal scales. So I'll point you to this chart right here. These box plots show the change in water point revenue for different operators. So each box is a different operator across our data set. And this is the change between the dry season and the wet season. What you see is 2 of these operators actually really on average don't see any change in revenue, so that people aren't switching to rain-fed water sources for those 2 operators. But for the other 4 operators, they have about an average of 1/3 less revenue during wet seasons, and that's pretty substantial. When we looked at the rainfall metrics, so we can't tell across our data set why that's happening. There could be a lot of reasons why that's happening, which you can read the paper and find out more about. But the rainfall metric that seemed to align the most was this metric of variability, rainfall variability. So instances of dry days during the wet season. And so what this means is you can kind of see these gray dots here are the operators that had no change in revenue during the wet season. And those are in areas where even during the wet season, people couldn't depend on rainfall to happen. And so they were more dependent on these piped water services. Whereas in the areas that are more orange, those are consistent wet and dry seasons, and people can depend on the rainfall to happen. And so they use rainfall and supplement and don't use the piped water services. So I'm quickly moving towards the implications because I've got 1 minute left with my time. But what we've presented here, local revenue generation underpins safe water service delivery. It's very important. And what we presented here is a large cross-country analysis of revenue across different kinds of piped water service providers. And we've found that revenue and equity goals can be promoted through sequenced investments in on-site and off-site infrastructure. So we in areas where people can afford to pay for household connections, that can generate more revenue. But also, off-site connections can generate substantial revenue for service providers and should not be discounted in sort of this planning cycle. Second, on the seasonal side, intra-seasonal rainfall analysis. So not just wet, dry, but looking at what's happening to rainfall within season can help service providers and policymakers understand the revenue threat and in areas where they have consistent seasonal rainfall is experienced. During the wet season, operators should expect that they'll have less revenue, and across our data set, it's about a third less revenue, and that should be planned for. And in areas where there is kind of more climate variability happening, those areas, there might be an increased dependence on the piped water services because people can't use that rainwater, supplement their water sources with rainwater. And lastly, although our data set only covers 6 service providers across 3 different countries, the recurrent patterns are there, and that suggests that these patterns are applicable or scale beyond our small data set. Again, I've pointed out that we've got 2 papers that you can go read a lot more about this. If I'm not seeing anyone snapping photos of this, but you can come ask me later for that, or you can Google it. And lastly, but very much not least, there are several folks in this room who helped me with data. So I've listed the agencies. I don't have time to name all of them, but the agencies that provided data to this, and also the individuals who helped to collate it. And thanks also to the REACH program for making this research possible. That's not me.
Okay. Thanks very much. Thanks for keeping perfectly to time. Great. So now we're going to go on to Bangladesh. Tariq Huda from ICDDRB is with us, and he's going to present on effectiveness of financial support program in increasing access to water, sanitation, and hygiene among residents of coastal areas in Bangladesh. Thanks.
Good afternoon, everyone. Can you hear me in the back? Cool. So today I'm going to talk about a study that we conducted to evaluate a WASH program implemented by BRAC, an NGO based in Bangladesh. I am from ICDDRB, a research organization based in Dhaka, Bangladesh. I think everyone understands this issue that I'm going to talk about. If we want to ensure sustainable access to water and sanitation for all, we need to understand and deal with the various contextual complexities. I'm talking about hard to reach areas. For example, if you can see in this map, this is a map showing the hard to reach areas in Bangladesh. This represents 1 in 5 union. So basically 1/5 of the areas are hard to reach areas in Bangladesh, even if Bangladesh is considered generally homogeneous, which means that in these areas, there are problems like access to sanitation, poor access to sanitation, poor access to water sources, high water level, frequent natural calamities, poverty. So that's why these are considered hard to reach areas. So in these hard to reach areas, there is poor access to water, sanitation, and hygiene because there is poor network connection. There is adverse hydrogeological conditions like either coastal area or drought prone area, and there is frequent natural calamities. And of course, there is a vicious cycle of extreme poverty. That is why we need targeted approaches to improve access to water and sanitation in these areas. Inclusive financing models, which includes microfinance and maybe grants, has been found to be promising in terms of reaching these hard to reach areas. That is why BRAC, an international NGO based in Bangladesh, has used their experience from working in Bangladesh for different problems, including WASH, to start this intervention in hard to reach areas of Bangladesh. And this particular program was implemented from 2016 to 2010. The program started with a community meeting where they sensitized the community about the program and what the program wants to do. They formed these village WASH committees. The idea was that these committees would identify the people that needs this microfinance like loans or grants, and also manage progress. So they would meet 6 times a year so that they can track progress. So from this program, financial support was provided in 2 ways. For the poor and non-poor, microfinance was given so that they can build dual pit latrines, or so that they can also build deep tubes for drinking water. And for the ultra poor households, which is people who earn half of $1.45, these are considered ultra poor households. For those, grants were given, so they don't have to give the money back, so that they can build dual pit offset latrines. And of course, they are also given water containers for water storage. A different approach was also adopted in this intervention, that entrepreneurs were supported financially and also given technical support. So water vendors and sanitation businessmen, they were given loans so that they can expand their businesses, so that they can then support the community. So the objective of the evaluation that ICTB conducted was to assess the impact of the intervention on access to wash services and health of the household members. So unfortunately, BRAC came to us when the program was almost closing. So we were left with no option but go with a post-intervention cross-sectional study design. We tried looking at different documents and we couldn't even find good baseline data. There was not good quality process documentation also. But we still thought this was important, so that at least we see what has happened there. At least we will have some data from this hard to reach area. So what we did was we designed this study in a way so that we can match the intervention and control households in an attempt to find this counterfactual. So what we did was, at first we matched unions. Unions are the lowest administrative unit in Bangladesh. It comprises of, say, 10 to 15 villages. So for each intervention union, we matched a control union, which was located in the same sub-district or a nearby sub-district. Then once the union was selected, we selected villages for both intervention and control areas. And then the households from the intervention areas were matched with the households from the control villages using propensity score matching. But again, the problem is with propensity score matching, you should have a lot of resources to cover a large area of the village. Otherwise, the propensity score may not be the best. So our propensity score was okay-ish. I would leave it there. So we conducted this questionnaire survey and spot check in 435 intervention and 435 control households. Our outcome was basically access to wash services. For the analysis, of course, for the binary, for the analysis, we considered intention to treat without considering the adherence to the intervention. So now I'll talk about some findings, and I'll have to be brief. So first, I'm showing you the indicators around drinking water. Fortunately, in Bangladesh, access to basic drinking water is very high, and there was basically no difference in the intervention and control areas. Maybe I should also mention that in all of the slides, the bluish bar is the intervention and the orange is the control. And in most bars, you see the odds ratio. These are adjusted odds ratio and the 95% confidence intervals in brackets. So when you looked at ownership of, so when you see that if the target household owns the drinking water source, we saw that in the intervention areas, the odds of owning a drinking water source was 3.23 times higher than the odds of in the control areas. And similarly, drinking water source located within the compound was higher in the intervention area compared to the control area. Now looking at the sanitation indicator, we saw that access to improved sanitation as defined by JMP was higher in the intervention area compared to the control area. Similarly, safely managed sanitation services was also higher in the intervention area compared to the control area. Improved sanitation facility accessible to all household members was also higher in the intervention area compared to the control area. However, safe disposal of child feces was not significantly different from the intervention area. But again, this was a intervention where the focus was on access, not a lot on behavior change. Considering the hand washing facility, indicator, so access to basic hand washing facility was higher in the intervention area than the control area. However, all the reported, so when we asked about when they wash hands with soap, the reported hand washing practice was not very different between the intervention and control areas, whether it is defecation, after defecation, or after cleaning child centers, or before eating. And one thing interesting you see in most studies from these low-income countries is that usually there is better hand washing practice around defecation, but around food preparation or eating is usually low. So this was an out of interest analysis I did. It seems like for coastal areas or climate areas impacted by climate change, there would be better climate resilient facilities. However, we saw that when you compare to the intervention and control areas, drinking water sources that were above the flood line was similar in the intervention and control areas. Sanitation facilities that is above the flood line was similar in the intervention and control areas. So that puts us in a tricky situation. When you look at the health data, the disclaimer is that our study was not powered to look at diarrhea or respiratory infection prevalence, because the prevalence is very low in Bangladesh, especially for diarrhea, it's very low. And again, this is reported. So basically, there was no difference in reported diarrhea prevalence or reported acute respiratory infection prevalence among all household members or under 5 children. So we have a long list of limitations. We didn't have baseline data. We had to rely on propensity score matching because we couldn't do random selection. We were not involved at the beginning of the study or the program. We could not assess actual behavior change because we didn't have the resources or the time to do that. And of course, I also already mentioned that we didn't have enough power to detect difference in health outcomes. So how do we conclude? Of course, we saw there was indication that there was better access to WASH services, which leads us to this potential conclusion that maybe financial solution, financial support alone could help with access to services. However, we do not know if that is enough to bring changes in health, because the magnitude may not be enough to bring changes in health. So I would, based on my experience, I'd recommend that we should focus more on behavior change also when we do this type of interventions. And finally, I would like to say that although this study had limitation, I think this was still a valuable exercise. This indicates that the intervention had positive impact on access to WASH facilities. So the BRAC guys did a good job, but of course, there is always chance to do better. So I would like to acknowledge the study participants, the enumerators. They did a tremendous job because we had a very short timeline and these were hard to reach areas. Sometimes they would be in motorbikes for hours, and women in Bangladesh doesn't like sitting in a motorbike with a man, but they had to do it for the study. So I would like to thank them. And of course, the team at BRAC and ICTTRB. So this project was funded by BRAC, and I have to say that ICTTRB thanks its core donors for ongoing support. Thank you so much.
Thank you. Another presenter kept perfectly to time. Lars, you have your challenge. We're going to hear next from Lars Osterwalder, who's with IRC WASH working on the USAID Transform WASH program, talking about piloting smart and targeted sanitation subsidies in Ethiopia. And I hope you're all keeping track of questions to ask everybody.
Right. Good afternoon, everyone. Thanks a lot for coming. It's the very last verbal presentation, I guess. I hope it's not the worst of all. No, thanks for coming. I'll talk about piloting smart and targeted subsidies in Ethiopia as part of USAID Transform WASH with a range of consortium partners. I'll give you a little bit of context. I will then talk about the National Sanitation Subsidy Protocol, go into the design of a small pilot that we started, share some very initial first findings from this pilot, and at the end, try to conclude with 5 take-home messages. So USAID Transform WASH is a relatively big market-based sanitation program. We want to stimulate demand, strengthen supply chains of sanitation products, and improved enabling environment, and the sanitation subsidies come under this last part. I work with the government to understand, improve market-based sanitation. We will have a poster out there, number 17. I'll be there, Monte will be there. Many other, Dagem, of course, will be there, who was an important part of this study as well, to answer more questions about USAID and the study. And the key question is, like, we are all enthusiastic about market-based sanitation. That will bring us from unimproved sanitation to improved. Market-based sanitation is a bit the thing in Ethiopia right now, but we need to recognize that it's not affordable for everyone. So together with the government, with the Ministry of Health, we had many discussions. Ministry of Health came up with those steps. So with there are certain households we can reach, population we can reach with just doing what we are doing. Others, if we can reduce the tax or remove the tax from sanitation products, it gets more affordable, will reach more people. Again, others with loan products and making more finance available will be able to afford sanitation products and improve their latrines. But there's the poorest, and the poorest we can probably only reach with one form of one or the other form of direct subsidies. So we'll focus on this very last part, but it's not the only thing that can be used to make it more affordable. So this National Sanitation Subsidy Protocol was led by the Ministry of Health with some support from USAID Transform WASH. We got that document published, was released in 2022, and it clearly states that subsidies need to be smart. Yeah, we don't want to undermine, we don't want to distort MBS or CLTSH activities ongoing. They also should be targeted. We want to reach the most vulnerable groups with subsidies and not people who can potentially afford and pay for a latrine on their own. And just give you a snapshot, there's 5 key principles in this protocol. So subsidies must be well targeted, using ideally a government-based scheme already in place. One of them is a community-based health insurance. I'll talk a bit more about that later on. That's the one we used. It should only target the substructure and the user interface or the flooring solution. It should only be part of the overall cost. So up to 80% can be subsidized, but the end user should either in cash or in kind contribute the remaining 20%. And ideally only introduce, or it should only be introduced in Woredas or in districts where already 50% of the population have improved sanitation and less than 10% practice open defecation. Just a bit of background, and I'm aware of time moving ahead. So what did we do? We did a pilot in 2 districts, in 2 Woredas in the south, close to Awassa. You may know it was in Sidama region. In April this year, we did a pre-implementation survey. Implementation took place from July to September, and only earlier this year, this month in October, we collected the post-implementation data. So it's very fresh, not yet presented broadly. In each of the districts, we visited 240 households. We selected 3 kebeles, that's the lowest administrative unit in Ethiopia. We selected 50 households in 2 of the kebeles, in all the 3, that are eligible. That means that are households that were on the list of the government to be exempted from community-based health insurance. They don't have to pay for this insurance because they're deemed to be the poorest within the kebele. So we use that for the targeting. Yeah, that's how we identify the poorest, or want to identify the poorest households. And then we also randomly selected 30 other households within the kebele, which we hope would represent more or less the whole rest. We had vouchers. They were delivered by local artisans. We call mason installers. They go house to house, promote, like they use a problem-led sales approach. So they talk, oh, you have this toilet, that's maybe you could improve this or that way, and then offer product at the end. All the control households were not offered any subsidy. They could decide whether or not they want to invest. The intervention households, however, some were offered a high subsidy, others a medium subsidy, so a voucher where they could buy the product at the lower price. So we had Sato skirting and the concrete slab with a Sato as the options that the household could choose from. So a few preliminary results. Again, here we just look at the wealth quintiles. We have the eligible ones that are the ones that are exempted from paying community-based health insurance, and the non-eligible households. So overall, the targeting is not too bad. Like when we look at the eligible ones, most households are indeed within the first, second, or third wealth quintile. And when we look at the non-eligible ones, the majority is in the richest, or the fifth and the fourth wealth quintile. But not only. Yeah, we have some of the richest in that are eligible and exempted from paying community-based health insurance. That we have here some of the poorest in the non-eligible. That was partly also the way we did sampling. Also, the service levels are a bit different. The eligible ones have lower service level, only 1% with at least basic sanitation, and 30% open defecation, while the non-eligible one have very low level of open defecation. However, only 10% basic. And you may remember I said we should have implemented only in places with at least 50% basic sanitation in the district. So we used official data by the district health office. They told us, no, that's okay, we are at 50%. So there's a different interpretation of the definition of what basic or improved sanitation is. Maybe as a background for people who don't know Ethiopia that well, people use dry pit latrines, and 90% of the population that use, or even more, that uses latrines, uses dry pit latrines. And it can be very tricky to say when it graduates from unimproved to improved. It's a bit of a tricky thing. And the indicators we use, the way we trained our data collectors, we only found 10%, while the government found higher percentage of improved sanitation. This slide, probably less astonishing, like you have seen that, I think, in many reports, so we could reestablish that. So if we look at the service level by wealth quintile, not necessarily whether they are eligible or non-eligible, yeah, the richer a household, the more likely it is that they have used basic sanitation or have access to basic sanitation services. And the poorer a household is, the more likely that they practice open defecation. Now it gets interesting, the conversion rate. What is the conversion rate? That just means households that were approached by a Mason installer and then made the decision to invest into an upgrade. So we can see if there is no subsidy, the payments are usually between 20 to 40 USD. And for the poorest, first to third wealth quintile, we got 0% conversion rate. None of the households invested into an upgrade. At a bit of a conversion, some people in the fourth, and about 30% for the richest wealth quintile. So with our sales approach, we mainly reach the richest and not even all of them. If we introduce and have medium subsidy, so a household would have to pay around 8 USD for the upgrade, something happens, like especially for the third to the fifth wealth quintiles. And you have seen before, like we had some of the richer households also eligible because they are exempted from the community-based, paying for the community-based health insurance. But the very poorest, still with $8 US, it goes up, but we reach a bit more, something between 20 and 30%. And only if we go to the very high subsidy, where households only paid 2 USD, we would reach for all wealth quintiles, for the poor and the rich, about 80% conversion. This slide, I think I don't spend too much time just to see the change of the service level for intervention households, and that in the two Veredas we worked, one is Saletta Wondo, one is Malga. we have had different results. It's something we need to look at a bit more closely, what the difference is between these two districts, why it worked much better in one and a bit less in the other one. So market distortion, do we now have a negative impact on the markets? Because we don't want that. I can give you a few information what we could collect. I mean, the USA Transform Wash will be ongoing, so we will continue talking to our business partners on the ground to find out if it got more difficult in selling their products. And hopefully next year or another time, we'll share the results with that, about that. But overall, we notice that most households, so if we ask them if they expect any further financial support to improve the toilet, the blue ones is yes. Most people, control or intervention, expect some kind of support. The intervention households the most, they're almost 100%, while the control, and the control aware, we mean households that were aware that other households in their Kebele received subsidies, expect a bit, it's probably not significant, the difference. So we also had the control of the ones that are not aware. So if households are not aware that others received subsidies, are slightly higher willing or do not expect any financial support in the future. We asked two other interesting questions, trying to figure out if there's any grievances. And that's only the results of the households that were aware. So that's control households that were aware that other households received some kind of support. And we were very pleased to see that we only got responses that households were happy for their neighbors. They think it's a good thing that neighbors received support. We didn't have anyone who said that they felt left out. We were a bit worried that we would get here higher numbers, but we had no one complaining about the substance saying, why didn't you give it to me? And the reasons why others received support, again, we were very happy to see that no one reported that the households that received the subsidies had better contacts or better connections. So it doesn't seem that there were some grievances that the wrong people received the subsidies. So I promised the 5 take-home messages, and I need to run a bit. Happy to discuss more afterwards. First one, a very general one, and the reason why we did this pilot or start the pilot all together. We will not reach universal access with purely market-based approaches. Yeah? As nice as it sounds, as a good approach, I think it is, and the right way to go, that households should invest for their sanitation facilities. We will not reach everyone. Also, the second point, even if we have relatively high subsidies, we will not reach everyone. Price is not the only factor. It's one factor, but there's other factors that would influence the uptake of or investments into sanitation facilities. The point, and ask me a question about that later on if you want to know more. I didn't show that many results about it, but I want to share it anyway. I think it's important. We didn't do that good with transparency by having the mason installers providing the vouchers directly. We had relatively few households that were aware that subsidies were provided. We were not that happy with that outcome. Like, we had some plans to have more transparency. It didn't work. And we feel going on in the next pilot or scaling up, we need to get better with transparency along with smart and targeting. The Wareda selection, the coverage may be inaccurate, and it was not fully accurate. So we need to figure out how we go really to districts that are well advanced and ready to receive subsidies. Last but not least, the targeting used by the government, this community-based health insurance, it's a good target. I think it's a good starting point, but some validation of those numbers before we start handing out vouchers would be recommended for us. So with that, thank you very much. And you have more information.
Why don't you come and sit up here? And can I invite the other 2 presenters to come and sit up at the front? I'm sure you're all full of interesting questions. Fire away.
Great. Yeah, great presentation. Thank you so much. I was really interested in the finding that you guys found the government data to be different than the data you collected on sanitation. And I know you were saying there's maybe a different definition that the government was using. I was wondering if that was a hypothesis or if you guys talked to the government and validated that. Just wondering if it might be a result of like slippage, like maybe the households did have basic sanitation at one point and reverted. So was just curious to hear a little bit more about that from Lars.
Okay, so hold on to that question. I'll take the next question and then,
Hi, thanks. Thanks for 3 really great presentations. I'm Rachel Peltz with the Kwai Institute. I had a question for Tariq about, I know that the initial intervention was targeted between the ultra poor and the non-poor. And I'm curious if you could speak about how the results or disaggregating the results by poverty level, if you saw greater impacts in which groups. Thanks. And then I had a question for Lars as well about sample size. So I noticed that you only had about 30 households in each of your categories when you split control and intervention groups, when you had the 3 different groups of different subsidy levels. And I'm not sure if you know this right now, but if you could speak to the minimum detectable difference or kind of like the error bars around some of your willingness to pay percentage data. Thank you.
okay, I'm gonna ask Lars first. Did you get the question, Tariq? Okay, good. Lars, you go first, then we'll turn to Tariq.
Good. Thanks for the questions. The first one is a relatively easy one. So like we are aware that definition of dry pit latrines, when it's improved or unimproved, is a big issue. We know, and the government knows, that the numbers reported are not fully accurate. So how it works in Ethiopia, it's the health extension workers would collect data in their village, report it at Kebele level, and how many people have access to improved or unimproved sanitation. That's then aggregated upwards. So you get sometimes very surprising and not super accurate numbers. And it's something government is working on also to improve over the next couple of years. The second question about sample size. So we had 480 households in total. Like it was, what I presented was for one of the Woredas, so we had that twice. In a final report, I will try our best to have proper error bars included, not yet done. Like the data came in 2 weeks ago, and it's kind of an action research. And as long as the differences are that significant, I think it's rather to inform us as a program how to move forward. And we know that it's not exactly fully accurate, but some numbers like the conversion seems to be pretty clear to make a decision based on it. But we will look a bit on the significance of the results.
Okay, Tariq?
Thank you. Thank you, Rachel, for your question. I have to honestly say that I thought about analyzing, but then I did not, because we only had 870 household and we didn't have the power to do the analysis. But for the manuscript I'm writing, I will probably add this in the supplementary table. Thank you so much.
Okay, more questions? Somebody must have a question for Andrew. He's feeling very left out here. That's what happens when you present first. It was so clear. It was so clear.
Yeah, actually,
Okay.
I do.
Excellent, good for you.
To know, since I think you said the data period ended in 2019, whether your results have been communicated back to some of the service providers in the countries that you did those analyses on, and whether or not there are plans to like implement and change things based off of results.
Great question, Megan. I was just looking at Laura because Water Mission provided some data, and I have communicated back, but I mean, some of these things, results were, the data was in 2019 ended, but it's not like I collected all the data then. It was collected over kind of 2020, 2021. And in some of these cases, the final papers, like the last paper was just accepted a couple months ago, or even last month. So I'm in the process of that. I have not had detailed conversations with, I think I can share Water Mission, Water4, Safe Water Network, the organizations, Ayateki Star, Baguli Traders Association, Power Technical Services. those groups, that's something that I need to do is communicate these back. I got my PhD thesis submitted, and now communicating back with service providers is something that I need to do a bit more of now. Thanks for calling me out on that, Megan.
You're still catching up on sleep, right? Any more questions? Yes, at the back. No.
Yeah, just a couple questions. One for Andrew. I think it seemed like, and I couldn't read your whole chart, but it looked like the day that you're showing that was affected by rainfall looked like it was only for Uganda, but then like Ghana and Rwanda did not see a lot of those changes. Could there be any like attribution to the actual like service providers in Uganda and not rainfall? So that's one question. And then Lars, I think you showed like your results from no subsidy and medium subsidy, but not high subsidy. And I don't know if that's available for us to see, the conversion rate for the high subsidy data.
Thanks. I'll take the next question and then hand it over to the panel.
Tyler Roy, Witten and Roy Partnership. This question's for Lars. So I was really interested in those medium, low and high subsidy data as well. And I'm wondering if you have any data on actual usage of the Satopans and latrines, compared to what they actually paid for it. So if usage was consistent or if it went down when there was high subsidies or up or whatever.
Okay. Very good. Who wants to go first? Yeah.
I'll go first since I have the
You have the
microphone.
mic possession.
Um,
Heads of the law.
Yeah, thanks, Laura. If you remember back to the slide, but I can just describe it. The first answer to your question, Laura, was what we saw was we have 5 service providers, 2 of them, or 6 service providers. 2 of them saw no change really on average in revenue. Some of the sites that they supported did see revenue dips during wet season. But on average, across all the sites that are supported by 2 operators, there was no change. Then other 4 saw change, and on average across those 4, it was a third or 30% less revenue during wet periods. So that's essentially half the year they're operating at 30% less revenue. Yes, there could be all kinds of explanations to that. So we're not trying to draw a causal link and say that rainfall was the only thing that caused that. It could be that those 2 operators that didn't see revenue change are just providing more reliable service. Customers are happier or whatever. The one thing I also did, I forgot, I'm glad I get the microphone and I get to say too, that we also looked at household connections and on-premises, off-premises connections, and we looked at tariff levels and we looked at payment approaches across those. And there was no association with any of those factors and revenue change during wet periods. So like people that have household connections also go use alternative water sources during rainy periods. People that use standpipes also go do this. So we didn't see any change there. The finding that we showed about the rainfall variability, I wish I could pull it back up. I'm not going to do that. But actually Ghana was an interesting case because the 2 operators in Ghana, one of them operating in northern areas of Ghana where there was reliable rainfall during rainy period, they saw revenue falls. Okay, the operator operating in southern Ghana, where there was this patch of this rainfall variability. So like during the wet season, they could even go days, weeks without rain during the rainy season. That southern Ghana patch was where the operator in Ghana that saw that stable revenue was located. So Ghana was kind of one of the triggers for us. We didn't run try to do any kind of statistical analysis on this or whatever. It was just literally overlaying the rainfall metrics with where these service providers that were experiencing this different kind of revenue exist. And it made sense. The Rwanda case was too, at first we were scratching our head because the operator in Rwanda saw stable revenue and we were like, why? But then when we disaggregated the Ghana data, we saw that there was that difference there. So hopefully that answered.
Okay, thanks.
Okay, thanks for the other 2 questions. Maybe one thing I want to mention as well, as I have the mic now, is like the main purpose of the presentation is to kind of start the discussion about market-based sanitation subsidies, how that goes together and how and where we should move with that. And having some first numbers to discuss. The high subsidy should have been there or was there on the slide. That was when people were asked to pay $2. So that's when basically also for the poorest household, it seems then they're willing to invest. This $2 seem to be about what the poorest households are able and willing to afford and pay. The second question, Tyler, I'm not sure if I 100% understood, but I tried to answer the way I understood it. So the installation quality as such was good. Like we checked in the survey whether households had invested, got the Sato pan well installed. And that was the case in all households. But again, it's really just 1 or 2 months after installation, after people invested into the into the upgrades that we went back. So we hope we have another 1 year that we could go back after half a year or 1 year to see again, is it still of good quality and are people still reporting to use the latrine?
Okay, thanks. Any more questions? I think I hear the clink clink of glasses. Yes, so yes, one more question here and one question over here.
I'm Will from Oxford. Question for Andrew quickly. Did you see any relationship between primary power source and revenue? I'm thinking about the links between rainfall and solar particularly.
Yeah, no. I tried to look at that actually.
No.
The answer is no. Yeah. So when I did the initial sort of what you saw here was after sort of looking at the data in aggregate and trying to cut it across a bunch of different ways and find different things that looked interesting. And one of the things I was interested in was the technology type, the solar, do people pay more for solar powered water system, water supplied from those systems? And the answer was no, I couldn't. There was nothing that stuck out, and I didn't even look at that on a regression kind of model because it wasn't evident from my data. But the data is going to be publicly available in a repository. So if people also are interested in kind of playing around with this in the future, it'll be de-identified, but it'll be available. So just to plug that, you can look out for that as well.
Yeah.
We need to look more closely into that. One reason is that some people enrolled into the community-based health insurance are relatively young and live with other households. So they actually have the right to get free treatment or like this health insurance. So they have access to that, they're registered, but they live kind of as a shepherd or as a support in another household. They don't have a need for their own latrine because they don't have their own house. That's one of the explanations we could already identify, and I assume we will find a few others.
And one last brave person.
Did you actually connect your revenue with income levels and where the connections are taking place?
No, I would have loved to, but that data was not available. So I was a parasite in the sense that I drew on data that others had already collected, and we didn't have good visibility down into the socioeconomic levels. So it's a major limitation. I should have included that. I wasn't able to look at that.
Yeah, it's a little bit maybe on the high side to say maybe it's seasonal reasons why people didn't pay, because sometimes people may not also be able to earn income. It's not just about collecting the water, but people may not be able to earn income during the rainy season to pay for water. So sometimes they skip how they use the water just because they cannot afford. But anyway, that is something for future. Thank you.
That's a great point. Thank you, Cynthia.
Thanks to all our panelists. Thank you very much. Okay.
sent you an email months ago and. I just wanted to be asking you all that was happening, but yeah, I wanted
I'm asking that question. How are you, my brother? You're like that. Yeah. No, all right, thanks so much. I didn't know you were.